Hello, my name is Dr. Fred Sylvester, and welcome to another edition of Health Talk. Today I'm very honored to have one of our exceptional guests that has a profession that is all about psychology, counseling, and she's been practicing since 1999, I think it is. Or you graduated from college from Chestnut Hill in 1999. Mm-hmm. We're looking at a couple different things today on the concept of how pain patterns and mental health and everything else kind of ties in together. So we are very honored to have Donna Pitkoff with us today. We wanted to kind of explore how back and disability and anxiety and rumination all kind of tie together, and how that can then be rectified and then have a person move forward in uncertain times. So, Donna, thank you very much for joining us today.
Thank you for having me.
Absolutely.
I'm excited.
So the question that we're going to start off with is I think where we should all start is, what is mental health? I mean, I think there's a lot of definitions out there, but people really aren't sure of what it is.
Mm-hmm. I would say that mental health is what constitutes our feeling of well-being.
Okay.
So it's what helps us adapt to changes. It's
Mm-hmm.
what helps us manage stress. It's what helps us feel balanced in mind, body, and spirit.
Sure. So when we're talking like mental health, and on our end of it, we see a couple different things on how back pain and disability can kind of play a factor of. Preparing for this, whole presentation, I think it's 4 out of 10 people suffer from back pain, which is almost like 83 million people across the United States. Mm-hmm. That number starts to challenge and trump arthritis, diabetes, heart disease, and so we know we're dealing with a very big number of people who have, we'll say, limiting or disabilitating conditions. Mayo Clinic then looked at, an observation. They concluded that 1/3 of people who have back pain classify it as severe. Okay, mm-hmm. And severe means that now it's all of a sudden it's interfering not with just, we'll say, conscious hours, but also unconscious hours, sleep and those types of things. Out of 80% of all work comp disability, that is coming from that 33% of severe back people. So what is the connection between like low back, fear, anxiety? How do they all kind of tie together? What is your experience?
Well, I think anytime somebody has pain, especially if it becomes chronic pain, mm-hmm. they start to worry.
Okay.
And worry becomes anxiety.
Sure.
If it goes on too long and they don't feel it getting better, they get a sense of discouragement.
Sure.
Discouragement can turn into depression.
Mm-hmm.
They can feel the limitations of, it can affect people's relationships.
Okay.
It can affect their ability to work. It can cause stress over finances. It can cause stress over the unknown. It can have a whole cascade of effects.
Mm-hmm. So when a person starts to kind of trump down that way, because I think like 50% of people that were interviewed said they have back pain greater than 5 years. So mm-hmm. there's this group of people that have that. So when we kind of look at it from the whole concept of like an acute pain where somebody bends over and hurts their back and that lasts for 1 or 2 weeks, versus a person who has it longer than 3 months or mm-hmm. God forbid going into the 5-year mark, what is the psychological changes, the physiological changes that are happening with these people, as you're aware of it? Like, does cortisol increase, does adrenaline increase? How does that all kind of factor in, do you know?
Well, the psychological changes are, people start to worry about, is this ever going to get better? Is
Sure.
this something I have to live with the rest of my life?
Okay.
And what is my life going to look like if
Mm-hmm.
I'm always in pain?
Sure.
It becomes like, and there becomes a need to navigate a whole new path,
Mm-hmm.
Something that was unexpected, something that's
Sure.
unwanted.
Yeah, life shows up when you make
Yeah.
other plans, right?
Yeah, I mean, for some people, it can also mess with their sense of identity,
Sure.
that we identify ourselves by what we can do.
Absolutely.
And when we can do less, then who are we?
Yeah. And I know I had an experience with that. I was in a in a car accident back in 2014, and I had a couple Ironman races set up and that type of stuff, and it took me out of that whole loop for a whole year trying to recover from that. So, a big piece of my identity was with Ironman, and that was being taken away. So I can totally appreciate and understand how all that kind of ties in, because you feel less than what you were once capable of doing, you know, and can you return to that level as well? So when we talk about a couple different things I want to kind of get into here is from the psychology end of it, is there's a couple key terms out there. There's anxiety, there's depression, there's rumination, there's catastrophizing. How do you explain that stuff? How does that tie in not only to low back pain, but to any type of, you know, external stress that might be overcoming to a person?
Well, anxiety is fear, fear-based. And there's all different levels of anxiety, from simple worry to severe debilitating panic.
Okay.
Depression is kind of a manifestation of hopelessness, helplessness.
Sure.
With a rumination, it's kind of getting stuck on one topic and not being able to move your mind off of it.
Sure.
Coming back again and again and again to the problem. And catastrophizing is kind of an expectation that the worst possible thing that can happen is going to happen.
Do you, in your practice, do you see a lot of that in your practice? I mean, I know in our practice, from low back pains and neck pains, when things are not going the way that people anticipate or want, you can start to see these things start to become more exemplified. But in your practice, I mean, how much does that fill your practice up with? Is that a small piece of your practice? Is that a large piece of your practice? Is that what a lot of people experience?
I would say that anxiety and depression are a large part of my practice.
Okay.
I would say the majority of the people that I work with have some level of one or both of those. Rumination, catastrophizing are usually a smaller part of the bigger picture.
Okay.
Where you know, those are what we would call distortions of thinking.
Sure.
The cognitive distortions and natural, understandable responses, I think, to chronic pain and to feeling hopeless. So it's something that we can work with on a cognitive level. It's something that I like to kind of dig underneath a little bit, because I think that working with thought alone is usually not enough. Thought, what we think, is based on what we believe.
Sure.
And sometimes we need to kind of dig under that and get to the core beliefs that were developed years and years ago.
Sure. So one of the things that we see in our practice, and some of the research I've read, is like if we have a patient that is going to be more anxious, depressed, you know, catastrophizing, rumination, there seems to be this also phenomenon called amplification. Okay. And I'll let you try to explain that on how that actually works. You know, where we see pain patterns that might really truly be a 3 out of 10, they're actually reporting a 6 and 7 out of 10. What's your thoughts on that?
That's really interesting. As far as pain patterns, I'm not so familiar with pain patterns.
Okay.
So tell me more about that.
So what I commonly see is that, you know, in this, like for instance, say you have a person who has low back pain, and you're doing the physical assessment, you're doing the palpations, you're seeing how much spasm there is, and there's not a lot, which would then would kind of come back into the zone of where this person should only have like a minimal or a mild amount of pain that they should be reporting, 3 out of 10, something like that. But they're reporting subjectively, it's a 6 or a 7 out of 10. And some things just don't add up at that point. The research I've read, especially with catastrophizing, is that the amplification process can be roughly about 50% is what it comes down to. Now, I relate it to the paper cut syndrome, which means that, you know, you get a paper cut, you don't know you have it, you look down and say, oh shoot, I cut myself, and then all of a sudden it goes from no pain to, oh, this really hurts. That's kind of what I've seen in the past. I don't know how true that is, but that's why I was just trying to get some, you know, insight from you.
I think that what you're describing depends on a person's focus.
Okay.
So, you know, it's kind of like there are terrible things happening in the world. There are also wonderful things happening in the world. There are good and beautiful things happening in the world at the same time. Why don't we see those good and beautiful things? Because we're looking at other things.
Gotcha.
We're looking at what's wrong around us. We're looking at the problems. So I think that maybe in these pain patterns that you're describing, the focus is on the pain.
Right.
The focus is narrowly zeroed in on that pain, and that pain becomes bigger
Sure.
That pain becomes the whole essence of what a person feels.
So they identify with it. They become identified with the pain.
Yeah.
So now this brings us into your whole concept of why we're looking at it and why you're here. So if a person would come to you, whether it's for pain or just for any type of counseling services, what could they expect to experience?
Well, my approach to counseling is a very intuitive one.
Mm-hmm.
I feel that every person is different. There is no formula. There is no one way.
Sure.
So, so I have lots of education and training. I've probably read hundreds of books, but I
Sure.
don't rely on any of that. My focus is on getting to know that person, like getting to know the uniqueness of the person
Sure.
who I'm talking to, and then tuning in a very intuitive way to finding in that person what they need.
Sure. What are the benefits for somebody who's seeking counseling?
Well, the benefits are a better state of mind, more emotional well-being, improved thinking, improved thought patterns, ones that are more adaptive to the situation. Sometimes changes in the belief structure.
Sure.
The person comes in believing one thing and they learn kind of a new way of thinking, of
Sure.
experiencing the world. So often I hear from people, I never thought of it that way.
Sure.
Part of the art of therapy is asking the right question at the right time. usually a question that we wouldn't ask ourselves.
Sure.
That just kind of comes.
What would be some of the risks of people who are dealing with anxiety, depression, catastrophizing, any of those types of components of not seeking care, not seeking counseling?
Well, the big risk, I think, with chronic pain is depression. I think a lot of pain leads to depression.
Sure.
But there's a saying that I like, and it's the things that we don't address become our limitations.
Wow, I like that.
And I love that because it's so true. And I think
For
that's
sure.
true on all levels. I think it's true on a physical level. Like I have scar tissue in my hip because I ignored an injury years
Sure.
and years ago, and for a long time that didn't bother me until it did.
Sure.
And I think that with mental and emotional things, the same thing happens.
Sure.
What we ignore, what we suppress, what we push aside, it doesn't disappear. It just gets driven underground in us, and it comes out later in ways that we don't expect.
How about that? So, in your experience, what to demystify counseling and psychology and that type of stuff, what are some of the misconceptions that people have of it?
Well, there are many, and that could, how much time do we have?
We have a lot, at least an hour.
I think the big, most relevant one to this topic is the idea that it's somehow a weakness to seek therapy.
Sure.
There's this common misperception that I should be able to handle this on my own.
Right.
I should be able to figure this out. And I think it's a misconception because we all have blind spots. We're too close to ourselves and our own situation to see it clearly sometimes.
Very true. And then that's where you assist in expanding that focus and expanding, we'll say, instead of casting a spotlight, a floodlight to the different aspects and concerns that a person may have and need to be addressed. Is that correct?
That's absolutely right.
So one of the things I just wanted to also kind of talk about is and you hear this often, mindfulness, cognitive behavioral therapy, awareness. Can you explain that type of stuff? And how would that kind of fit into a treatment plan of somebody that would either have, again, I don't want to limit just to chronic pain, but any type of condition that they felt that they were under the duress of the suffering that they're going through?
Well, mindfulness is all about bringing ourselves back to the present moment. So we really don't exist there most of the time.
For sure.
We think about the past, that what you talked about earlier, the rumination. We replay events of the past over and over and over again. So in some ways we exist in the past.
Okay.
we also worry about the future.
Sure.
You know, someone with pain, for example, worries about what's going to happen next. Will I be able to work? Will I be able to survive? So mindfulness is a way of bringing ourselves to this very moment through our experiences, through our senses, through taking in all of the information in the moment right now.
For sure.
And it's a technique, it's a skill, it's something that takes practice. It's something that most people don't do innately.
And you're able to teach that?
Absolutely. And with cognitive behavioral therapy, there's a lot of focus on what are we telling ourselves about ourselves. You know, what are the thoughts that are running through our mind, and what are they grounded in?
Sure.
You know, how do we dispel thoughts that aren't necessarily true?
Sure.
So we can work at the level of thought. We can dig below that to the level of belief.
Okay.
We can sometimes look back to the origins of that belief. We can come up with new, better ways of thinking about things, expanding on thoughts.
Sure. And success, you know, when you're looking at that, and I know it's hard to measure, but when you're in practice and that type of thing, success rate, is it very tedious to overcome this? Is it a quick thing? How would you classify it? If you're looking at a treatment plan of dealing with a person and how they would move through.
It depends on the person, and so it's kind of hard to measure. As far as quick or slower, everybody moves at their own pace.
Gotcha.
There's a certain readiness for therapy, and there is a certain willingness to entertain new ideas.
Gotcha.
So, but I would say, as far as success rate, I would say it's very high. People feel better, usually after the first session.
For sure.
People report feeling better.
Absolutely.
I've seen sometimes addressing issues that have been avoided or have been kind of pushed aside, expressing what's been unexpressed for years and years and years can melt away tension.
Wow.
I've seen some reduction in pain just from the tension that we hold in our muscles.
Yeah, like when I was preparing for this, we were looking at the physiological effects of just back pain itself. And what we find is that the kidneys secrete cortisol and adrenaline. And those two hormones at this point, what they do is their overall effect is for fight or flight. So that means that they're going to tense things. So if you're already in spasm and you add these two to the equation, the overwhelming or the overarching mechanism is going to be more tightness, which is going to be more pain. So as you were saying, if you can reduce that fight or flight through the intervention at this point, I would assume that that patient would start to feel better.
There is some reduction in pain from that alone.
Absolutely.
And also in relaxation techniques that we teach sometimes.
Very well. So if you had to sum everything up in your take-home message for the viewing audience today, what would it be?
Well, I think that because there's still that misperception that it's a weakness to seek therapy, I think my take-home message would be that your mental and emotional health is every bit as important as your physical health, and that it's really a sign of wisdom to recognize that and to get help when you need it.
Thank you so much for being on our show today. Very enlightening, very powerful. Gives a lot of people hope to move forward. I want to say good day and good health.